Asthma is a common inflammatory chronic disease of the bronchial tubes. This disorder is associated with airway hyperresponsiveness, inflammation, and tissue remodeling. Primarily, the airways are open and tranquil, allowing the air to easily enter and exit through the lungs. Prior to an asthma attack, homeostasis is maintained. However, during an asthma attack, homeostasis is disrupted. Homeostasis is the ability of the body or a cell to seek physiological constancy within its internal environment when reacting to external stimuli. Homeostasis is essential to keeping the body under control, upholding the conditions for our cells to live and function. In this case of asthma, the disease interrupts homeostasis through multiple triggers. Typically, threatening asthma is triggered by the immune system responding to inhaled substances such as pollen, house dust mites, and mold spores. These substances contain proteins, which for people with hay fever cause their immune system to overreact and release a chemical called histamine. Histamine causes allergic reactions and exerts its effects by binding to histamine receptors on cells' surfaces, thereby activating irritations towards the eyes, nose, throat, and skin while interrupting the smooth muscle in the lungs, ultimately disrupting homeostasis. Unfortunately, allergens often cause acute attacks. This is due to the inflammatory molecules called leukotrienes. This is one of several substances during an asthma attack that are released by mast cells. Leukotrienes seem to mediate inflammation in the airways, causing cholinergic receptors in the airways to respond by tightening the muscles. This process is called bronchoconstriction. Leukotrienes also tend to increase the secretion of mucus, penetration of inflammatory cells in the airway wall, and of course reduce airflow to the alveoli. These molecules also attract eosinophils into the bronchioles. Eosinophils play a main part in causing general bronchial hyperreactivity, while also having to produce leukotrienes. Overall homeostasis is disrupted, with leukotrienes being critical in both causing severe asthma attacks and longer-term hypersensitivity of the bronchial tubes in asthma. Generally, the other triggers for asthma involve the common cold, irritants in the air like smoke, exercise, and extreme weather conditions. All triggers change the normal breathing patterns of the individual due to the airways narrowing. With exercise, weather conditions, and irritants, the airways narrow due to the cold, dry air inhaled rapidly, or eventually our lungs lose water, heat, or both. With a common cold, the body starts to produce more mucus to catch the viruses and increases the temperature to make it uncomfortable for the virus to multiply, causing severe symptoms such as constant coughing, chest tightness, throat irritation, and the feelings of anxiety. The negative feedback loop for the respiratory system is the increase in our breathing rate. This is because it manages the breathing and energy use that goes to muscles while pushing oxygenated blood into working muscle tissue, especially during intensive exercise. Although a person that contains asthma disrupts this negative feedback loop through the flare-up of inflammation and an excess amount of mucus produced, limiting the appropriate amount of oxygen needed within the lungs. According to one study found by respiratory therapist John Petrell, respiratory viral infections like the common cold are responsible for 85% of asthma attacks in children and 50% in adults. Not only is respiratory viral infection the leading cause of asthma attacks, but is responsible for most severe asthma attacks and attendance at hospitals, ultimately causing many symptoms including severe wheezing, difficulty breathing, breathing through the mouth, rapid breathing, and difficulty in talking, with the possibility of respiratory arrest and death. This is why this infection is known to be a very critical trigger due to the life-threatening possibility. Fortunately, there are current treatments and antagonists for asthma, although in the past, treatments for asthma were completely different. Doctors in the 1800s indicated that patients shall be prescribed caffeine, iodine, opium, and morphine. People developed milk diets, and lastly, Dr. Adrian Peru's favorite remedy involved the inhalation of smoke from anti-asthma cigarettes or powders. These treatments were considered to relieve both asthma and hay fever in the 1800s, but scientists have investigated heavily into this disease and have discovered multiple current treatments that have been clinically proven to improve asthma. These are two specific current treatments named Montelukast and Zafirlukast. These are leukotrienes receptor antagonists and are designed to relieve the symptoms formed by leukotrienes. Both treatments are antagonists for CYS-LTR1, which is critical in mediating many of the pathological responses to CYS-LTs in humans, which are a family of inflammatory lipid mediators like mast cells and eosinophils. Montelukast specifically reduces the bronchoconstriction, ultimately blocking the action of leukotrienes, while also having the ability to reduce inflammation. Zafirlukast's purpose is to inhibit the immune system and reduce the production of inflammatory mediators. Zafirlukast is the first cystaneal leukotriene receptor antagonist approved by the FDA and is known to be useful for long-term treatment of asthma, although this drug has been noticed to be less efficient than inhaled glucocorticoids. Inhaled glucocorticoids is another current treatment used to act against asthma. This treatment suppresses airway inflammation by activating anti-inflammatory genes, switching off inflammatory gene expression and inhibiting inflammatory cells. In addition, they enhance beta-2 adrenergic signaling by increasing beta-2 receptor expression and function. The net effect is control of the symptoms and signs of asthma in most patients. Effectively, these actions supply the body's negative feedback loop with a sufficient quantity of steroid hormones required to fluctuate and function properly. Overall, these treatments are improving but not completely restoring homeostasis and are allowing patients to continue their normal diet and exercise routines. Scientists have investigated into multiple new treatments for asthma in order to help overall asthma control. These new treatments developed can be a possible option for people who experience acute attacks. One of these treatments is called bronchial thermoplasty. This specific treatment is involved to deliver controlled therapeutic radiofrequency energy to the airway wall, consequently heating the tissue and reducing the amount of smooth muscle present in the airway wall. Bronchial thermoplasty has been found to improve control and reduce exacerbations, with an adult clinical study created. This study found that adults with severe asthma that were treated with this treatment, with their continued medications as well, experienced the following benefits: 32% reduction in asthma attacks, 84% reduction in emergency room visits for respiratory symptoms, 66% reduction in days lost from work, school, or other daily activities due to asthma symptoms, 73% reduction in hospitalizations for respiratory systems. This treatment was only first approved by the FDA in 2010 and appears to have great potential for future patients. Another future treatment that is developed to evaluate in severe stubborn asthma is humanized monoclonal antibodies. This humanized antibody is useful for patients with serious refractory asthma with tenacious eosinophilia, as IL-5 is blocked. IL-5 tends to cause acute eosinophilia asthma within patients, which is why blocking IL-5 is vital, with this action showing to produce consistent benefits in the reduction of severe exacerbations, asthma control, and improvement in lung function. Humanized monoclonal antibodies also have the ability to block immunoglobulin, which is known to treat allergic asthma specifically. This is also recognized to improve asthma control and reduce critical exacerbations. Ultimately, these future treatments have shown to produce positive results and have shown scientists to realize these treatments have potential to revolutionize this disease, asthma.